Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to go over some of the major advances when it has come to knee replacement surgery in the last couple of decades. So before I jump into this, be sure to hit that subscribe button and turn on the notifications so you can catch all of our latest videos related to knee replacement surgery. So these are some advances that, they've been around for a while, probably for the last decade, the last couple of decades at least, kind of have been up and coming trends, up and coming advances when it comes to knee replacement surgery and, the knee replacement world, so to speak. And these are just some of the common things out there, and I'd love if you're someone listening to this, if you see anything that you've heard about or have information or questions about, be sure to leave those comments below and we can have a good discussion. So the first thing, of course, is the robotic arm-assisted surgeries. And these are, of course, ever growing in popularity. All these different hospitals, healthcare systems are buying this technology and using this technology with the surgeons to perform their knee replacement surgeries. And these surgeries and using the robotic arm technology is really going to help improve the accuracy, the precision, the fit, the alignment of the knee replacement process. And it's hopefully going to decrease any injuries or damage to, muscles and other soft tissue. And the hope is that with this technology and with this improved precision and accuracy, there's going to be reduced cutting or unnecessary cutting of any of the bone when it comes to resurfacing the bone, and also reduced soft tissue damage and reduced soft tissue cutting. And that's going to lead to a faster recovery, most likely and hopefully. So there's still a lot of research out there in terms of, what are the differences? Do people have differences in terms of efficiency or effectiveness in their rehab and recovery after surgery through traditional means compared to a robotic arm-assisted surgery? And it's really hard to look at this because there are so many variables, so many things that play a part in your overall outcome and success from surgery. So to really pinpoint the effect of this one specific thing, it can be really difficult. What I do say is there's plenty of people who have traditional knee replacement surgery who have outstanding outcomes, and there's plenty of people who get robotic arm assisted surgeries and they have great outcomes too. And then in both boats, there's unfortunately some folks who don't have great outcomes and aren't necessarily satisfied with their final outcome. So still a lot of comparisons out there to determine how much improvement, how much better the robotic arm surgery is or is not. Another advance in knee replacement surgery is same-day knee replacements. You may hear this referred to as outpatient surgery or ambulatory hospitals or ambulatory surgery. And basically, just like it sounds like, you're going in, you're getting your knee replacement done, and a few hours later you're on your way home. And this is a great option because, one, it helps with medical healthcare cost savings and cost savings for the healthcare system in general. It's great because, you don't want to stay in a hospital, for 2 nights or 3 nights. You want to be home, the comfort of your home, the comfort of, if you live with, family or having that support system available, or just being in the comfort of your home if you're someone who lives alone. And the reason for these surgeries is just, improvements in the entire process. So of course, improvements in the surgery itself, but also improvements in, education before surgery, in terms of screening individuals, in terms of setting up strategies to manage pain effectively, getting people set up with therapy early on so that, you don't have to stay in the hospital. You can have this surgery on an outpatient basis and you can then start your rehab and recovery in the comfort of your own home. And with that, we also have partial knee replacements or minimally invasive knee replacements. So a partial knee replacement surgery, of course, has been around a very long time, but basically it's only replacing or only putting a new knee prosthetic in one compartment of the knee. And oftentimes that's that medial or middle compartment, but it can be the outside compartment or underneath your kneecap as well. And the benefits of this, of course, is it's less invasive, less cutting of bone and soft tissues, and maintaining your normal anatomy, more of your normal anatomy, and not changing as much. And for most people with a partial knee replacement, you're really able to tolerate a lot more, you're able to recover a lot faster, and still have pretty good quality of life and participation in activity for quite a while. And the reason for this is arthritis develops oftentimes at different rates in different parts of your knee. So it may not be necessary to do a total knee replacement and replace all the parts of the knee. It may be appropriate just to replace that part that has progressed with the arthritis a little bit more significantly. With minimally invasive knee replacements, there's some different strategies, different techniques out there, but you can think about that being a shorter or a smaller incision, possibly using techniques to spare the quadricep tendon, so less cutting through the quadricep tendon, that tendon that comes from your thigh muscles. And that the idea is this leads to a faster recovery as well. So something worth talking about if you may be a potential candidate with your surgeon and your doctor's office. And then the last thing I wanted to touch on in this video is pain management. And there's really been a development of what we call multimodal pain management strategies. And basically that means using different modes, multiple different modes and ways to manage your pain effectively. So when it comes to the surgeon and the hospital, of course, they're looking at your nerve block and the anesthetic that they give you for the surgery. And then they also may incorporate a femoral nerve block to add some additional pain relief early on in that early phases of recovery as you come out of the anesthetic and are in the hospital or in the recovery unit. They're talking about medications, so using opioids, different opioid prescription medications, but also using acetaminophen, using anti-inflammatories to help with the pain management, get you up, get you mobile, get you moving early, and having that pain under control. And then of course there's multiple conservative techniques for pain management that don't incorporate medications. So icing, elevation, doing physical therapy, doing range of motion activities, compression. There's lots of different things out there to help manage that pain effectively. So those are just a couple of the big advances or the big topics that are out there when it comes to knee replacement surgery. I'd love to hear if you've had any personal experiences with any of these topics that I brought up, or if you have any questions about anything. I'd love to hear it in the comments below. And of course, as always, please be sure to hit that like button so we can spread this video to other viewers who may benefit. And I thank you very much for watching.